Hi everyone and welcome to a new episode of Parentally Unfiltered. Today my guest is Pascale Lamacchia. Pascale is a fellow French, a mother of two, a Chinese medicine practitioner and a massage therapist. Pascale is also a doula and as such, she has supported many births over the years. In this episode, she shares both her perspective as a mother and as a professional working closely with women. We talk about birth, really unfiltered, the way she sees it and the many ways she's witnessed it, and what actually happens beyond what we're usually told, the real story. Hi Pascale, welcome. I'm really happy to have you here today to open this first season of the podcast. Let's start from the beginning. Can you tell us about who you are and your background story?
Yeah. Thank you for welcoming me. So my name is Pascale and I'm French. I have a daughter, Juliette, who is 29, and I have a son who is 26. And I've always been fascinated by everything around pregnancy and birth. And since I was a child, even my mother tells me that I was like when I could see a pregnant woman, I could try to touch her belly, and I was really into babies. I was really fascinated by this. And actually, what happened is that I had my kids quite young, and my births were quite easy and short, I would say. But I was really shocked about the protocol at the time because I wanted a natural birth, and actually it was a big clinic. And when I got there, it was like your point of view is not something we're gonna follow anyway.
Oh.
So it was like, okay, these are the protocols, and I didn't have an option. And when I was trying to say, I don't want the epidural, I don't want to lie down, actually, I was not listened whatsoever. So it was really, it was really a shock, especially for my daughter, because my water broke and the process started at the hospital because I had to go to the hospital at the time. So I was 3 centimeters dilated, and the midwife came and she said, it's now time for you to get the epidural.
Oh, wow.
And I said, no, I'm feeling fine. It's not painful so far. And she started to pressure me saying, I have a lot of women giving birth today. I don't have the time to be next to you. You're gonna suffer like hell. So you have to take it. And she left the room, and the anesthetist came and put me the epidural.
Wow.
So it was really like a shock. And then came the dilatation went really fast. And like 1 hour later, I was 10 centimeters. And so I was in the hospital only for 4 hours in total. Okay.
Mm-hmm.
And the gynecologist arrived, and he looked at the clock. So he started to speak with the midwife. And he looked at the clock and he said, I have some inductions to do. So I'm really busy, and I have to finish with you really quick. And so I had even not started pushing because I was with the epidural. I couldn't feel anything and whatever. And he said, okay, I'm going to take your baby out. And I looked at him like, okay, what does this mean? And he took scissors. He did episiotomy, forceps, took my baby out, put my baby on me, and shake my hand. Have a good day. And it was like, my mouth opened, my eyes opened, looking at him like just happened. It was a nightmare. So I was really in shock after that. And I try to speak with the midwives and stuff like that. And it was like, no, you had a really good birth because it was short, it was quick, it was easy. You didn't feel pain, blah, blah, blah. So it was for them, it was the perfect birth. And I was really, really shocked, really.
Oh, wow.
So this was not okay, but so I changed gynecologist in between my 2 pregnancies. And for my second birth, I said, okay, this time, I don't want to be pushed into having epidural and stuff like that. Mm-hmm. And so I arrived at the clinic. I was 7 centimeters dilated already. And when I got there, she said, "Okay, we go directly to the birthing room." And I said, "Okay, but I don't want to lie down on the bed because I had really big pain in my back." And she said, "You have to lie down, otherwise we're gonna attach you to the table." That was her answer, and I was
Oh
like,
my God.
"Okay, yeah." A bit of a shock one more time, and I said, "No, I don't want." And she started to be really pressurizing me. And she said, "Anyway, the anesthetist is here. We're going to give you the epidural right now." And same happened. So I had the epidural, but my baby just came out straight away after that. It was, the pushing phase was really like too push. But still, it was, my labor was 2 hours in total, and I was shocked by the fact that I had easy birth and nobody was following my needs and my feelings. So it was really, I was feeling like, okay, I don't want any woman to experience this in her life. And I started thinking about being a midwife at the time. And my ex-husband was in the army, and so it was not possible for the on-call period and stuff like that. So I didn't do it at the time. And at some stage in my life, I changed I changed job. I retrained. I did my Chinese medicine therapy, and I started to have some clients and some pregnant women. And I was doing acupressure and some massages. And this is when some clients started to ask me if I would come for the birth to do some acupressure points. And at the time, my partner had moved to the Netherlands for his job. And when I got to Amsterdam, I saw that there were schools for doulas. And this is when I said, yeah, why not maybe training as a doula? So this is what I've done. And I moved 2 years later to the Netherlands. And this is when I started to work as a doula as well. And the first time I witnessed home birth, this was really a very special moment in my life because I really felt this is the right thing. It was like I was picturing the birth I had, and I was like, this should have been the birth I should have had. And I was feeling at the right place, right moment, helping. It was like I had done this my whole life. And from then, I really started to follow couples and do some birth. Yeah.
Thank you so much for sharing your birth stories, because it really helps us to understand your background and how you came full circle. And this is how we came to know each other, actually, through Parentally, and you joining also the meetups that we organized for expectant mothers. And this episode today, we're going to talk about childbirth. And when I was thinking about who to get to best talk on this topic, your name immediately came to mind, because I think like you talk about it with such passion. So I'm really glad that we finally got to do this together.
Yeah.
Like you mentioned, you kind of have, you wear several hats. You are a Chinese medicine practitioner. You are also a doula. So can you tell us a bit more about how these different practices connect you in your approach to birth?
Actually, I combine different training I had because for me, birth is different. I need to work on different things for the woman. I mean, physically, it's like, as I always say, for me, birth, it's like an onion. It's like in the middle, you have the process of birth, which is like a software, which all woman has in her, actually, in herself. And to unfold, you need to remove all the different layers on top, which are physical tensions, emotional traumas, and stuff like that, which are sometimes blocking this natural process inside. Okay. So my approach is, so physically, I follow women every month or 3 weeks, depending on the symptoms, because actually all the symptoms a woman can have during the pregnancy, I can really help the pain you can have on your sciatica, reflux, nausea, everything. You can feel the legs when the legs are really heavy. So all these kind of things, because the treatment I do is going to make the energy flow in the body without blockages, because the blockages are giving the pain. Okay. So I look at the meridian and I make the energy flow again.
How does it look like, basically, when you say you look at the meridian? Is it a touch? Is it a
Yeah,
treatment?
exactly.
Yes.
So the treatment, so I use reflexology under the feet. I check how the organs are. And then I go on the body, I press some points when I find, for example, an organ which is not working properly. Then I go on the meridian, because all the meridian are linked to the organs.
Okay.
So when there's, for example, the liver is low, for example, then I will find on the meridian of the linked to the liver, for example, I will find some points which are blocked. Okay. So my treatment is to find those blockages, and with massages to help this to unblock the blockage. And when I unblock the blockage, then the symptom is going to disappear. So this is the approach I have every month to taking into account. And it's nowadays, I really think that women need to be listened to, especially when, I think it's the case for everybody, but especially during the pregnancy, they have symptoms, pains, and emotionally it's very difficult. And I think that the professionals, the midwives, don't take enough time for me to listen to what's happening physically, emotionally, even in the couple for this woman. So I really take the time to try to understand where this woman is, and I'm gonna help with those messages. And at the same time, I trained as an EFT practitioner as well. It's emotional freedom technique, which is a technique to release the traumas. So, for example, when I do my follow-up for a client, I really discuss with her if there are some traumas which happened in her life that she didn't process, because those traumas can make some blockages, because in Chinese medicine, we consider that each organ is linked to an emotion. So if she had too much anxiety or anger or stuff like that, she will block more easily some organs. So I really help on this side as well. And I really help on this, for example, when it's a second or third birth and the woman had a really traumatic birth for the first one, for example, I really work on what happened in the first place, so that on the due date, she doesn't have the trauma coming back and her fear just blocking the process. You know?
Okay. So you have in general a few sessions prior to childbirth.
Yeah.
And then as a doula, you are supporting the birthing people in pregnancy and then also during childbirth, correct?
Yeah.
Yes.
Exactly.
So shall we actually dive more into the process of childbirth and what actually happens? And maybe let's start with the basics. Can you tell us about what's actually happening in the body when labor begins?
So the start of the labor, it's actually it's a cocktail of hormones which are released in the woman's body, and it's completely automatic in her body. She doesn't have to do anything for it. The more known about birth is the oxytocin, because the oxytocin is a hormone which is going to make the uterus contract to make the baby come out from the belly. It's this cocktail of hormones is going to rise actually to implement the process inside the body, and it's going to start to have an effect on the cervix itself, which is going to soften and to erase, and then the dilatation is going to start. But this process can be really easy if the body of the mother is well balanced. This is what I work on during my session before the birth.
I've heard about, different stages of labor. There are different stages, right? From a physical perspective.
So it starts like she starts to feel like back pain, feel uncomfortable a bit sometimes because of these hormones. They all even have an effect on the different muscles in the body. Means, for example, the intestine is going to want to empty. Same as the stomach. Okay, those hormones have an effect on this. So sometimes you can start. She has back pain. She has diarrhea. She doesn't feel like eating, and she feels like, I feel that something is going on. So this is the really first step, and then she's gonna see that this sensation, she's going to feel really on her belly that it's starting to contract. And for example, it can be like 4 times an hour at the beginning, and then she'll see that the contractions are going to be closer and closer. And for me, looking at a woman, I can tell where she is in her labor, listening to her and seeing how she behaves with her body. Because in the beginning, when the contractions are arriving, she can still talk with the partner and do other things and blah, blah, blah. And suddenly she sees that during the contraction, she needs to concentrate and she needs to stop doing anything else. So this shows that the labor is really starting at that time. And at some point, she's going to feel like, I feel that I need to be by myself. Okay, she starts going to the toilets or stay in the bathroom, and she starts moving. It's really like she does movement with the head, with the hands. She goes on her tiptoes. She's like, when you're uncomfortable and you're trying to make this uncomfort just stop. So this means that she's going into active labor. And at this point, she is like, the contractions are about 5 minutes apart and lasting for like 30 seconds. So this is start of the active labor. And after that, it's more from the sounds that you will feel that she's going to do some really low sounds. Actually, the mouth is connected to the vagina, and a woman who is using her mouth to do those sounds is actually helping the dilatation to happen. So
it's fascinating.
Yeah,
So
this is a very good sign. Very good sign. What is not a good sign is when a woman is starting to do high pitch screaming and stuff like that. This means that she's going into too much adrenaline at that time. So adrenaline is a hormone which is going to be very important at the end of the labor. When the baby needs to come out, there's a shot of adrenaline for the mother to have the capacity to have the ejection reflex. But too early in the process, actually, the baby is not ready to come out. So she's going to go into panic. She wants to leave the place. She's really angry. She's, she feels like she's trapped. So this is when, actually, when I support a birth, I'm really into observing the mother, helping the father to help as much as possible the mother, but I'm trying not too much to interfere in the way they work together for the labor to progress, actually. But when I hear, for example, the last birth I attended, I left them on their own, and suddenly I heard that she started to cry and to be overwhelmed and panic and everything. And then I stepped in and I started to do some points to calm her down and to make sure that she breathes correct. Because actually, when a woman is panicking, the fact that she doesn't breathe correctly, this is going to be very difficult for the rest of the labor, because the breathing is the most important thing during the birth. Okay, so when this is happening, you really need to have either your partner, either midwife sometimes is helping for that as well. But you really need to have somebody who is going to to help you breathe again correct, so that you stop panicking. So this is very important. And usually when she got to this point, she's usually going into transition. And transition is just the moment, it's the edge actually before she dive into the ejection reflex or the pushing phase. Okay. So what can happen? One possibility is that she keeps breathing, and in the breathing process, at some stage, the baby's head is going to touch the perineum. And this is a reflex, like going to poop. To poop, it's a reflex inside your body. You don't have to do anything normally for it. And the birth, it's meant to be like that. Means that when the baby's head is on the perineum, then you're going to have the shot of adrenaline, which is going to make your body push the baby out. Okay? So this is the first version. For the first baby, sometimes this reflex doesn't happen completely. I mean, and they feel that at the end of the contraction, they feel like something like holding the breath. Okay. This holding the breath means that she can put a bit of pushing, and then she helps actually the process. So it can happen either with the ejection reflex. I had it on several births. Or sometimes she needs to keep this pressure she feels to help the baby calm down. So one of those two. So if it's the ejection reflex, then the baby can be out in just one contraction. I've seen it already. Or if she's pushing, then you will have the crowning of the head at this stage. And then after the crowning, you have the full head coming out. And if you have with the hands off midwife, then she's not going to do anything unless there's the need. The head is going to come out with in the right position. I mean, the baby is looking down if the mother is on the back. It's not that I say that the mother should be on the back, but it's not a good position. And at some stage, the head on its own is going to flip to the side to make sure that the shoulders can go through the pelvis as well. So the baby is going to adjust, and sometimes you really have the head even turning and several times doing the little movement to find the best option for the shoulders to come out.
It's fascinating.
Yeah, it's really a process. So this is when sometimes I really get angry when I see a midwife getting the head and pulling this baby out with a lot of strength. This is not needed whatsoever. If the mother is okay, if the baby doesn't have a bad heart, there is no point in holding this head and pulling with strength. This is going to have some consequences of this baby on this baby. So if she doesn't do anything, then you see that slowly one shoulder is going to happen, and a few seconds later you have the two shoulders, and then the full body is out.
So that's a huge question. Does the body really know when it's time to give birth? Can the body really know, and really how? Because is it something that you just feel like it's time and then it just happens?
The coming out of the baby on its own, it's really linked to the trust with the mother's body. It's all the persons in the room should trust the woman's body to be able to do it. We shouldn't be doing anything unless there is a medical reason for it. And I can tell you that I saw some births where I was like, okay, why is this midwife doing this? Because the baby is fine, the mother is fine, and there is no reason for her to hold the head and pull on this baby. You know, it's a natural process. It needs time, it needs patience, it needs trust. If you wait, it's going to happen. Okay, sometimes some help is needed, but when you are in an environment which is really helping the release of the right hormones, this process is going to happen on its own without doing much. I really can tell you that I saw some births. You just wonder why this doesn't happen more often, really. It can be as simple as this sometimes. Most of the time, I would say 90% of the time, it can be like this.
So from what you've seen and in your experience, what are the most helpful things that can help labor and the whole process of childbirth progress naturally?
Actually, I would say that the mother needs to dive into what's happening in her body and to accept what is going on. And for the people around her, she needs to feel safe. And hormone-wise, the oxytocin, it's really linked to melatonin. That's why the labor is usually starting at night because of the light going down. So, for example, when I go to hospital and I see all the lights on and people talking to this woman and many people in the room, this is not okay. To help the process, this process I was talking about, this software inside the woman, you need less light, you need silence. She shouldn't be feeling observed. When you have a midwife in front of you, looking at you, yeah, it needs to happen. Yeah, you need to push. This is putting pressure. Oxytocin is love. Oxytocin is feeling secure, feeling safe, feeling good. It's the hormone you have when you have sex. So if you put this woman in the right condition, then the body is going to work the best. But one more thing really important is that if you have a mother who is too much into anxiety, too much into her neocortex, which is the thinking brain, the analyzing brain, then she's going to be in trouble at some stage. Because if she stays in this brain, she's very conscious. If she's very conscious, then she's going to feel the pain even more. Okay? Because if she goes in the reptilian brain, which is the one where this software exists, actually, she's going to go in a kind of a different state of conscious. Means she's like in hypnosis. It's like her body is changing the way is going to feel the sensations, the people around, the noise, everything. It's a different state of consciousness. But to help this, she needs to stop analyzing, oh, these contractions was harder than the other. Oh my God, I'm afraid of the next. Oh, this is not helping the process. So actually, if you want to help a woman give birth in good conditions, not to feel the pain too much, and to feel safe, you need to have this ideal conditions with little light, silence, and she needs intimacy. It's a process. It's something happening. It's linked to your sex. You're naked. You are
It's
in
like
a
a bubble.
Yeah, actually, it's really this. And you really need to let the mother really dive into this bubble. And in this bubble, she's like protected, and the people around are really here to make sure that she feels safe. Because the woman that is going to feel safe is going to give birth in good conditions. Sometimes when we have a transfer and we arrive at the hospital, they're really nice here in the hospital. They're really coming and saying, oh, I'm the gynecologist, I'm the midwife, hello, I'm the nurse, my name is blah, blah. But this woman is in labor. She's not into talking. You shouldn't be talking with a woman in labor. And each time I'm like, I get there, I close the curtains, I switch off the lights, I tell the father, okay, ask those people to leave the room, because she needs to feel safe. And to feel safe, it's not with 10 people in the room talking to her and the lights on.
Let's talk more about your role as a doula, actually, and how you support women during labor and childbirth. Can you tell us about your experience and what you observe that women need the most physically and emotionally?
For me, when I take a doula client, the most important thing is the pre-birth. She needs to trust me. Sometimes I had some clients telling me that it's the fact that they know I'm around and I can help if they need, that made them able to leave the neocortex and go in their reptilian brain. The link with the couple is very important for me. It means I meet them very often. I try to get to know them. During the prenatal sessions, I really focus on having a link very close with this couple, because I need to see how they react to the stress period to deal with. So I really make sure that this woman feels safe with me, trusts me, so that on the due date I can help her more easily, because I know her reactions. This is for me the most important. And on the due date, it's like I said before, I observe a lot, observing what I could do to help her. Sometimes it's just being there, looking at her in her eyes, breathing correct myself so that she follows me. Sometimes it's a lot of this. And when I see that the pain, the intensity is quite high, then I start doing some acupressure points, because there are acupressure points very helpful to balance the intensity of the contractions on the back. Sometimes for some births, for if it's 10 hours, I do those points for 10 hours. Because it's really helping the woman to cope with the intensity of the contraction. And then my role is really to make the partner as a team with her. I want to work together to make this baby come out. We need to remember as well, is always talk about this with my client. It's it's the last stage of the lovemaking session they had together. So it's how did you do to make this baby come in? You can help with the baby coming out, and it's a lot of of love. It's this partner really looking at her in the eyes. I trust you. You can do it. I love you, you're beautiful, and all those stuff which are going to help actually the process, because her oxytocin is going to rise, So I really make the partner help as much as possible. And it's like a team around her, really trying to disturb as less as possible what's happening. Okay?
Can we talk more about the partners, actually? Can you tell us more about how the partners can play actually a more active and meaningful role during the labor and childbirth?
Yeah. So I would say it's life-changing how the partner is going to be involved and feel that he's done something. Because those partners that I had, for example, I've been following some families with 2 or 1 or 2 kids already. And the partners were saying, oh my God, the births were horrible. I was in the corner of the room. My wife was screaming to death and I couldn't do anything. Those fathers are completely into trauma, because they felt they couldn't help. She was in hell and they couldn't help. So this is the worst experience for a father or a partner. What I try to do is to make you involved as much as possible, gently, and as we know each other, because I've met him as well a lot. Just from looking at him, taking his hand, putting him on his partner's body, and just telling him, okay, take her like this, or take her in your arm, or try to help her breathing. I give some little things for the partner to feel empowered, and the mother as well. It's the team. I try to help the team. Because if he gets involved, if he sees that she was like, I can't do this anymore, and he can manage to look at her and say, yes, you can do it. We're going to do it together. Let's breathe together. He's going to feel like, okay, I've helped. I've really done something. Sometimes I tell the midwife, let's let this father get the baby out from the mother. And when this happens, you can see on their face that they are so proud, so happy. They felt involved in the process. And this is going to change completely the postpartum period, because a partner who has been involved in there, it's proved that when they are close to the baby, they develop in their brain the same areas that mothers develop when they are in contact with their babies. So it's really they felt that they were part of the process, they not just witnessed the process, they were part of it. When it's like this, then it's really, really powerful for the couple and for the next family coming out from this experience.
It's really true what you're saying, that it's really hard to see your loved one in pain and feel like you can do nothing. I've heard a lot of fathers saying that they felt helpless, and it's very rare that you see your partner in such pain. Because you were talking about the intensity, it's very, 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 very intense.
Yeah, and they're gonna see their partner in a situation they've never could imagine, and they're like, "Oh wow, this is huge!" And they look at her like, "Oh wow, my God!" And they want to save her. They all want. I'm sure that you ask. They want to take to take the spot and let me do it because this is horrible. I can't let this happen. And when you manage to make them involved, then they feel empowered. They feel like they helped. They really helped. I had some fathers saying, "Wow, she was so powerful. I'm so proud of her. She did so well," and they're really proud of their partner. It really changes in their mind this situation of being there, witness the pain, the intensity, the scream, and doing something. Sometimes I'm like, okay, try this and do this. And they see that what they're doing is helping. This really makes the big difference. Yeah.
Yes, that's so true. Let's look at the other side. Have you seen in your experience behaviors or things in general that tend to either slow or interrupt the natural process of labor and childbirth?
It's all about what I told you before. It's the environment is very important. And I could see sometimes, I have the example of a birth. She was doing really well at home. We were a team with the husband and really helping. And she was really, the dilatation was going quite fast, like 5 centimeters in 2 hours, something like this. And then we transferred. And for me, the transfer is a really tricky moment in the birth. Means if she's in her bubble at home and everything is okay, she's coping with the contractions, then transfer, if she's usually naked or doesn't have many things on her, okay, at home, you have to dress her. You have to get organized. The passport is in the bag. Did you take this? Where are the keys? Is the neighbor coming for the dog?
I see.
Stuff like that. Then get a taxi. Here, the taxis, sometimes they are not happy when they see you coming out with a mother in labor.
Yes.
I had just for the anecdote, it's quite fun, not funny on the moment. A taxi took us with the woman in labor and the partner. And after 100 meters, he stopped and he said, "No, I'm not taking you to the hospital. I don't want to." Yeah. He stopped the taxi and he left us on the side. And it was the first time for me, the only time, but it was so, and actually the midwife was following us. And you need to know as parents, it's important that the midwife is not insured to transport you in her car.
Okay.
So sometimes I have some parents saying, "Yeah, the midwife didn't want to have me in the car," and they take it like, she didn't want me to be in the car. No, it's not you. It's that she's not covered in case of accident. She's not covered for the clients in her car. But in that case, when she saw us, because she was following the taxi, when she saw us coming out of the taxi, she stopped and she said, "Okay, what's happening?" And I said, "The taxi driver doesn't want to take us to the hospital. He's afraid of the birth happening in his taxi." And she took us in her car and we went to the hospital. But the transfer, all this actually is really taking the mother to come back to reality. The bubble is gone. So when I know that a couple wants to be transferred in birth center or the hospital, I really prepare this before. I tell them to get organized, take a cover so that the taxi driver is happy to see that you have a cover to cover the seat. Put some music in earplugs for the mother to have some music. Put some sunglasses on the eyes, or this night band you put on your eyes.
That's a good idea. Yes.
Yeah, just she needs to try to stay in this bubble, and these kind of things are going to make a difference. And when I get in the car, I do my special points. Means I don't sit in the car. The mother is going to be very, very uncomfortable, and then the intensity will be so high that she will come out of the bubble anyway. So go on your floor or on your knees, and when I'm with a client, I do some the points I was telling before to remove a bit the intensity of the contractions.
Yes.
Okay.
Yes.
And when we get there, it's what I said before. Switch off the lights. Don't use the bed to lie down on it. Use it as a support, but don't lie down on the bed. And when we talk about the birth plan, I really insist on writing down what they want in case we have to go to the hospital. And I make it very obvious for the father that the number of the people in the room is very important. So I really tell them to put it on the birth plan that they want to recreate this bubble inside at the hospital. Means when my client arrive, usually with the night band on the eyes, with some music in the ears and stuff like that, then it stops people from talking to them. So this is really helpful. But most of the time I look at the father like, okay, we are too many people in the room, and he takes the time to say, okay, if the people are not needed for the moment, we call you when she needs. This is the kind of thing that can stop the labor, or sometimes the contractions are 15 or 20 minutes apart again.
Yeah.
So you can lose 2 to 3 hours of labor just with the transfer sometimes.
I see. So there's something that's making me very curious, because you said do not lie on the bed.
Yeah.
But also before we were talking about the position during childbirth, and you mentioned, lying on your back, but not very positively. Can we talk about the positions and why not the bed?
Yeah, why not the bed? So we say that this position on the back with the legs up, and actually your vagina facing the people, this is very convenient for the medical people. Okay, for the woman, I can tell you that if you give the choice to a woman giving birth naturally, I will never. I won't say never, but if a mother follows her instinct, she will be very close to the floor, usually on her knees or on her fours, or on one knee. Yeah, one knee up. But she won't naturally go on her back, because going on your back, you can understand it physically, because the sacrum is a bone that is a moving bone. If you go on your back, your sacrum is going to go up. You can do the test if you stand and you move your pelvis from the front to the back. You can really feel that the opening down there is really changing. When you are on your back, this possibility of moving your pelvis doesn't exist anymore. So the bone are closer to each other. So first of all, what is going to help something going down? We have gravity on Earth. Okay, we need gravity. If a woman use the gravity during the labor, the baby is going to take the best position and come out with the smallest part of his head first. Because a woman lying, for the baby, it's a struggle to find the right path. And this is when
makes sense. Yes.
When you have a woman with epidural, for example, when the epidural is done too early, then you can have a baby stuck because the baby is not in the right position. And as she's not moving anymore and just lying, for the baby, it's a struggle. And this is when you can have some bad position for the baby coming out. Okay.
But that's what I wanted to say. But if you get an epidural, you are not able to move anymore, right?
It's not always the case. Actually, if you talk with the anesthetist saying, okay, I want an epidural just to remove most of the pain, but not everything, that you can still feel your contractions. It's a question of dosage. Huh?
Okay.
And then if you are in this case, then you can go on your knees and hold the back of the bed, for example. You can be on your side. You
that's
can
good
be,
to know. Yes.
Yeah, there are several. Actually, when I do my birth preparation, I show the clients everything you can do on the bed. I can tell you can do a lot, really. But when you get to the hospital and you still want a physiologic birth, which is totally possible, don't use the bed to lie in it. Because as soon as you lie, first the feeling, the pain is going to be a lot more. It doesn't help the baby to come in the right position. And the lack of gravity is not going to help the process. So when you get to the hospital, use the bed as a support, as everything you want, but not for lying in it. Then if you are exhausted, go on your side. go on your side. Sometimes I see that a client is too tired and I'm like, okay, the expulsion will be difficult. Okay, go on your side.
It's funny because it seems impossible on your side. How does it work? So you lay on your side?
Yeah. You lay on your side, and if for example, you're on your right side, you take your left knee over your right leg. Okay. And actually, if you try to do this, you really feel that it's opening your hips on the back. And I saw some birth videos of women giving birth without even opening the legs up. Huh?
Oh, wow.
She's totally lying. The leg is over the leg on the bed, and the baby's coming out like this. It's not a problem whatsoever. For me, the most challenging position for birth is the back. Yeah.
So if there's one thing you wish every parent to be knew before going into labor, what would it be?
That the mother's body is really incredible what he can do, and to trust the process, because fear is really something which is going to interrupt the process. Really, I see, because I follow couples from different countries, and the fear around birth can be really linked to your nationality. French people, for example, are really into fear. And pregnancy and birth for French people is something dangerous. It's something, don't be too happy because something might happen. You never know. What if, and security, and blah, blah, blah. It's all about this. So when I work with French people, I take a lot of time. I don't try to make them change their mind. Huh? It's not my objective, but I inform them what the body can do, what your hormones can do, what the trust can do. And I remember a couple I had 3 years ago. And when I met her the first time, she said, I want to go to the hospital. I want epidural. I don't want to feel anything. I was like, okay. I don't try to make them change their mind. I just support what they want. But during my birth preparation, I really explained how the body was working, how the neocortex was blocking the system. We met a lot before the birth. And on the due date, so when I got there, I saw her, and it was the first baby. But I straight away I saw that the dilatation was going quite fast. She took a bath, and she was breathing in the bath, and she was doing some really low sounds. And I was like, oh, maybe I should call the midwife, because I don't want this baby to come out with only me. When the midwife was coming in the apartment, I took the mother out of the bath to her bedroom. I put her on the bed. She was on her fours. And I was doing those acupressure points. So the midwife arrived. She put her gloves. And actually, I was telling my clients to take a deep breath in. So she inhaled. And when she exhaled, the baby, the most powerful ejection reflex I've seen in my life. The baby it was
incredible.
The baby came out in one go on the bed, in the middle of the bed. We were the four of us looking at the baby, and I told my client, I said, grab your baby. And she turned her head and she looked at me and she said, I've not pushed yet. And I said, your baby's out in your breathing. The baby came out. And she looked on the bed. She took, the faces of the partner, her, and it was unbelievable moment.
Incredible.
And she labored in like 6 hours. And she had a mother completely traumatized from birth, who said the whole pregnancy, the most important for you is to get the epidural, get the epidural, get the epidural.
Yes.
This was the only thing. And when she called her like an hour later from her bed with her baby in her arms, because the mother was visiting just for the birth, and she left her 6 hours before. And then she was on the video with the baby in her arms, and she was like, what? she couldn't believe it. And she said, yeah, and as you can see, I'm home. And she said, what? You
That's
did
an
this at home?
incredible story.
This was the most, one of the most amazing one because, the suitcases were in front of the door. We had not organized. The only thing I had told, because I tell my clients in advance to always put some protection on the beds, on the couch, just in case. And I had told her like a week before, I said, okay, you don't want to give birth at home, but just put some protection on your bed just in case the water breaks during the
Yes.
night or whatever.
Yeah.
And she said, oh, okay, I'm going to put it by chance because she could have thrown the mattress. Huh? Really.
Yes, I can
The,
imagine.
it was just, and she was like, "Oh, but this was so easy. It felt so safe. It felt so good. And now when I have a couple who is doubting about the risk, about the security and everything, this is actually the client who accept to talk to some clients to talk about their experience.
That's such a fantastic story. I think that's
Yeah,
one of the stories everyone should hear. Everyone who's pregnant should hear.
exactly. He was like, okay, you don't want to feel it. Okay, but let me just give you the information. Let me just tell you how we can help you, how we can support you. And actually, I saw her a couple of weeks ago, and she said, yeah, I'm definitely having all my kids at home.
Mm-hmm. Mm-hmm.
She's and I had this kind of a story for a lot of couples actually that want to go to the hospital, and we never go there because
Yeah.
we don't have the time for it.
But that's the stories that we hear less often. We hear more of the kind of the
The
horror stories. And
you know
what you said about the French, sorry.
yeah
What you said about the French is very true. I had the exact same mindset the first time I was pregnant. I said, I
Hmm?
want the epidural. I don't want to feel anything.
yeah.
So I really recognize that. That's so true.
Exactly. It's, the approach of birth as a French approach is really about fear. It's like you're pregnant. Oh, don't be too happy because we never know if you're going to have a miscarriage. Don't be too happy because we have this ultrasound check and we need to check. Stop it. Be happy. And what's going to happen? It's going to happen. That's it. But 90% of the time, everything is going perfect.
Mm-hmm.
So don't be negative. I know miscarriages happen. I know sometimes you have some problem with the baby, but it's not most of the time.
Mm-hmm.
So be positive. And this is what I like here. This approach of fear, it's really something we need to give them the information to make them understand why it can be different.
Mm-hmm.
And I really have a lot of stories like this. And for example, my client for January, she had an easy birth, but she's not been listened in any way in what she was feeling.
Mm-hmm.
And she was like in panic. And as the birth was going quite easy, the midwife was like, good, it's going well. So when she was like, I'm dying, I can't, she's screaming, and the midwife was not listening to her.
Mm-hmm.
And she felt completely traumatized. So now she's pregnant with the second one, and the first one is 3 years old now. She's still crying when she talks about the birth. This is not okay.
No.
So now she took me for the second birth, and I'm like, okay, we're going to find solution. Even if you can take maybe a bit of morphine to help you for the transition. If it's too difficult for you, if we're going to find solution, but you need to have a good experience about your birth. This is not okay to tell somebody, oh no, you're not overwhelmed. No, she's saying she's overwhelmed. So don't say that she's not overwhelmed. Sometimes I look at my client and I say, yeah, I know it's difficult. I know it's intense. I know you're in pain. I know you need to acknowledge what the person is going through. You can't just say, oh no, it's not because the birth is going easy, So yeah, French people need really a lot of care, prenatal care and information and a lot of compassion for everything she feels, all the emotionally, physically. I really treat them differently from other nationalities, I have to say.
Don't you feel like things are shifting a bit?
It is,
Yes.
but there are some stuff happening for sure. But I think I talk from French perspective. I really think that it's going to take a long, long time for birth to come back. out of the medical system, because nowadays in France, birth is something medical. You need, you really hear people
So
saying,
true.
the gynecologist made my baby come out. No, you did it. You know, it's really, as soon as you have the gynecologist in front, he has the power on everything. Even for me, when I was in this clinic, I was feeling like the envelope of this baby. The baby was the only objective. And what I was feeling, like when I said I feel too bad lying down, no, they're not even listening to me. It's not, your point of view is not listened at all.
Yeah, I
Okay,
understand.
it's a
Yeah.
medical thing. They look at you, it's our job, you know? But when you know that medicalization of birth, it's quite recent if you look at the whole time of the human on Earth, okay? It's, you know, my grandmother gave birth to my grandmother when she was 7 months, in the 7 months months pregnancy. The baby was really tiny. They went to the hospital. They said, this baby is going to die. Just give her a name and just wait for her to die. And the mother said, no, I'm going to breastfeed her and she's going to be okay. And she went home. She breastfed this baby all day long and all nights long. And this baby recovered. It was my grandmother, and she died at 97 years old. She had a really, very special life, without giving too much details. But she was not sick. It was the end of her life. It was her last breath. And because of this mother who fight for her kid.
Yes.
Fight for your kid. You know, a kid that comes in the world in good conditions, with peace, with people trusting the process, with no noise, with no medical interventions, with no pulling, with no forceps and stuff like that. Life is completely different. I can tell you, because I do sometimes some postpartum follow-up as well. And I can tell you that those babies are really peaceful, really peaceful. For me, the best moment when I do a home birth is to leave this, because usually I help the mother to have her shower, and I put them in bed and I leave them there, and I'm like, okay, I've done my job. This is the best moment, when I feel my heart full of love and I have the shot of oxytocin for 2 weeks.
Yes.
It feels so right. It
Tired
feels so
but
right.
happy. Yes, I can imagine.
Exactly. It's so good for
Yes.
everybody. And those baby, it's like Michel Audin was saying, that we're going to change the world when we change how the baby are born. It's all about this. And he was saying we can't do anything for this birthing mother. We can just make sure that she doesn't get too undisturbed from what's happening. That's it. That's it. We need to be humble in front of this process. The body is amazing. The body is doing a pregnancy from a cell. You go to a baby 9 months later. Nobody did anything from outside. I'm really pissed off with induction nowadays, because inducing a woman because she's getting over 41 weeks and she's fine and the baby is fine, this is not okay. This is not okay, because induction, sometimes it works well, but sometimes it doesn't work well, because this baby is not ready to be born. All these cocktails of hormones I was talking about before is not ready. It's like you want to do this film, but nobody is ready, and you take them quick, get ready, no. Sometimes it's not okay. So I'm not against medicalization. This is not the point. Let the natural process try to happen. And sometimes I'm the one, when I have somebody wanting a really physiologic birth, and I see that it's 19 hours and she's still in the pool breathing and nothing is happening. I'm sometimes the one saying, okay, now I think we need to go get some help. You know, sometimes you have some doulas, we are really into, it's physiology, only physiology. No, I'm not like this. And one day I had, I think it was the nicest things I heard. It was a woman. She wanted to go to the hospital. And the pushing phase was really, really difficult, because she had epidural for many, many, many hours. It was like 2 hours pushing, and we were a bit worried about the baby. And And actually, when it was all done, the baby was out, the gynecologist said, thank you, because I've had a lot of doula here, and it was a fight because they wouldn't let go of the physiology when it was not working. And I'm not like this. When I'm in the hospital and I see that it's not happening, I'm the one saying, okay, take a bit of morphine, maybe you get a bit of sleep. Or take the epidural. So it's like when you decide to do a marathon, you know that you're going to have a lot of pain in your muscles because you're going to train hard. The birth is exactly the same. You know that you are going through all this pain because you are birthing your baby. So you can accept to go through this pain and you have endorphins, which are going to come at some stage with the rise of oxytocin. Your body is going to understand that, okay, we need to bring peace to this person. So at some stage, the endorphin is going to put you in a more peaceful state to cope with the contractions. But at some stage, when you have very, very long birth, and for example, it started the last night, the mother didn't sleep the whole night, and stuff like that. I can really see the moment where this woman was accepting pain, and suddenly I see on her face she's really suffering. She's really fighting against what's happening in her body. And this is not okay, because this is going to have the consequence of being a trauma for her. Okay. So I'm always, for example, I had a birth recently. The first baby, she had it at home, but it took her 36 hours to have the baby at home. And so she wanted the second one at home as well. So we started home, and at some stage I could really see after 15 hours that she was exhausted. She had the whole night up. She was exhausted. And I said, listen to me, because we had talked about the first one. I said, have you experienced suffering, and were you really over your limits? And she said, yes, definitely. So then in this process, I said, okay, I don't think it's okay for you to maybe give birth in 36 hours as well. I think let's go to the hospital. You get a bit of help and you're going to birth your baby naturally. And she said, okay, let's go. And we went to the hospital, and actually she needed just 1 hour of remifentanil, which is morphine, to cope with the most important just before transition, actually. And then they stopped the remifentanil, and she pushed naturally her baby out. It was all okay. And then the experience is a lot different now, because she did what she could, but she reached the limits of exhaustion. And sometimes I think that it's better to get 1 hour of help than to wait 40 hours at home. This is not okay. You see? So my practice is I support the physiology as much as possible, unless we see that, okay, bad position of the baby, the heart is not good, the mother is exhausted and she can't do anything. And, you always need to try to assess how is this mother, because if it's to let her 30 hours laboring, okay, she has the power, but at some stage she needs the power to push the baby out. And a client, she talked to me about her first birth. Actually, she did this, and when she got to the expulsion, she didn't have the energy anymore, and she got C-section, and she was so disappointed. And I said, no, this is not okay. Sometime one day I had this, and I told the woman, I said, take the epidural. We tried with remifentanil, was not enough. I said, take epidural to be able to birth your baby yourself, not to have a C-section. And she took it, and then she could birth her baby. Really, my objective is this woman shouldn't have a C-section. Okay, unless there's an emergency, for sure. I'm not completely mad, huh? But okay, we try to assess the situation. It's it's a balance, about like everything. It's a balance between physiology, medicalization. How is the mother, how is the baby doing, and then we adjust. And You can do all the birth plan you want. For me, birth, it's about adjusting, and it's hour by hour. You never know.
Mhm.
We always adjust to the situation, and we can change our mind if we see that what we had planned is not possible. Keep your eyes open on what's going on. Don't be stubborn in, oh, I want physiology and I'm going to suffer for 40 hours. This is not okay.
Mhm.
This is not okay, and end up with a C-section or no.
Mm.
So it's a question of a team, of an assessment of a situation, and then we take decisions step by step with patience, with support, and with trust with this process, which is magical when you let it happen.
Absolutely. And
Yeah.
thank you for sharing this point, because I think it's a very important one. And, people talk about birth plans, but it should really be birth wishes, because for as much as you want
Exactly.
things to happen one way, they will most probably go the other way.
And, at the same time, because I had this discussion with my last client, she said, yeah, we're doing the birth plan, but all my friends, they did birth plan, and and everybody ended up with something different.
Yeah.
And I said,
Exactly.
yes, for sure. But what would you like? Oh, I want this. I want a home birth in the pool. And I said, we're going to try to make you have what you want.
Yeah.
Okay. And if this doesn't work, we're going to take all those decisions. And actually, this client had the home birth in the pool in 6 hours for first baby, and everything was fine. And she said, oh, wow, I had what I want.
Yes.
And I said, yeah, because it can happen. If we put everything around, it can happen. And I see more people having what they want than the other way around.
Yes.
Okay. We just adjust sometimes with the situation. But if I look at the birth plan we did with my client, I can really tell you that except those who wanted the hospital and we had home birth, but they had, really beautiful births in the end.
Yes, absolutely. And with some nuances, like you mentioned before, it's just that sometimes things cannot happen the way they should, and not everything is possible, and that's just the way it is. Yeah, absolutely. Pascale, can we talk about also what happens immediately after the baby is born?
The first thing is that the mother is going to have the biggest release of oxytocin when she sees her baby.
Mm-hmm.
And this is the last phase of the birth of the placenta. And this moment must be as well protected. And because sometimes it's all, the baby's out, we put the lights on, everybody talks. And no, it's the last phase, very important phase, because the mother, she really needs this oxytocin to release her placenta safely and not bleed. So this is very, very important.
We never talk about that, the release of the placenta. It's never talked about.
Yeah, for me, we talk about it for the birth plan because since a year, I suggest, because I saw so much pulling of the placenta and it really makes me pissed off. So I really talk about it. And in the last birth I did, I suggested to the mother to take her placenta out by herself. Going on her knees, so she gives the baby to the father, skin to skin, and she goes on her knees, and she takes her placenta out by herself by gravity again, really helping. Actually, she feels the placenta going in her vagina, and she pulls it out. Okay. And this is really helpful, because if she doesn't do this, then the midwife is going to like massage the belly, which is very painful just right after birth. And she's going to pull on the placenta. And this is when you get the risk of a piece of the placenta getting stuck if the placenta is not completely out of the uterus. So for me, I really tell the parents to do this, and we did this for the last year. This year, all my clients did that.
That's good to know. Yeah.
Yeah, and what I would add as well is what's really important after birth is that the mother is really yin. In Chinese medicine, there's the yin and the yang.
Yeah.
So the yin is the emptiness, because the uterus is empty now. And, so the mother is too yin. So you need to bring her some yang, means only warm stuff to drink, warm stuff to eat.
Mm-hmm.
So no sushi. I know that women are eating sushi. So usually it's sushi, cheese, and charcuterie.
Mm-hmm.
No.
True.
Okay. Not yet. Okay. Because you need hot stuff. You need stew, you need curry, you need lentils, you need stuff that are going to help you recover.
Mm-hmm.
And stay in bed as much as possible. Your perineum has been working like hell for the whole pregnancy. Even if you have a C-section, it's the whole pregnancy on your perineum, so you need rest. Okay? So it's really the 40 days after birth are really important for the mother's recovery. And in some Chinese medicine, it's very important for her to lie down a lot, and especially for a woman who wants to breastfeed, skin to skin is very important because the baby he can smell the breast, so it's gonna the breastfeeding is gonna be easier to start. She needs recover. So actually she stays in bed. Somebody cooks for her. She just get rest. She's done the most powerful thing in her life so far. First time or several times. You need recovery.
Absolutely.
Really.
That's a very important point, and I think a lot of people focus a lot on childbirth, but postpartum rest and postpartum care is also key, and I think it deserves its own, episode to talk about because it's so major.
It's so important because then the one who are not following this, usually I see when the baby gets to 3 months old, something like this, it's quite very hard for them because the recovery was not done properly. And you have all those short nights and all this tiredness there, that it makes it very, very difficult at this stage. It's so important. 40 days are really, really needed. Really, I think that the partners should have like a month around the mother to be there to help. And it's really precious for her, even for the couple and for the family, for everybody. It's worth to take this time. And babies need contact. They were in the belly for 9 months. They need contact. Take them on you. Don't think that the baby is getting used. And no, baby needs contact. And at some stage, he will take his independence. Okay, it's very important. Do some, hold those baby carriers are really helpful in the first month. Use them. Recovery is the most important.
Yes. And I think
Emotionally,
I agree. And I think there is a lot we can take as inspiration from what's being done in Asia, in Southeast Asia. There is a lot, like, I think postpartum care there is so much different than what we have here. Let's take some time to reflect a bit, and I would like also to look into some of your advices. So looking back at all these years that you had supporting families, what is something that you've learned about childbirth that still amazes you?
I think the fact that love can do a lot.
Oh, that's beautiful.
Really.
Sweet. That's
really, really. When I see what I told you before about those partners looking at the birthing mother and saying, wow, she's a goddess. If guys were the one giving birth, I think there would be no babies on this earth. Yeah, women are amazing. Women are amazing. Like I tell my clients, you are really, you are magical people. I'm so proud of all the women I witnessed giving birth to those baby into this world. I'm so proud of them because they are so powerful. I'm really amazed by the power of the body of the even the one that said, no, I would never do that.
Yes.
Yeah, for sure you're going to do it. You're going to do it. I have no doubt. If I can tell something, I have no doubt. When I support somebody, I have no doubt. I trust them completely. And I'm super amazed by give love to somebody, give compassion, give patience, give, kindness, care. Nowadays care is really difficult.
That's true.
People need care. Sometimes it's only holding a hand and telling her that she's doing it, that she's amazing, and you put trust in her. I trust them. It's my client doing it. I'm not doing it. It's them.
I love your answer. Care is the answer. You've already answered a little bit, but my last question is, what is the message that you would like to share with someone who's pregnant and maybe a little nervous about giving birth?
Get informed, but there's a problem nowadays with information is that there is too much information. Too much, too many courses, too many lessons, too many, and people are going in all directions at the same time. For me, the most important is to find your right team and then trust on this team, build on this, and don't try to listen to all the birth experience, because actually you get all the fears from all other people when your experience can be totally different. So I always tell my client, if you have a question, WhatsApp me, no problem. Even if it's 10 o'clock in the evening, I will answer, because I don't want those people to Google it and to end up on very, very traumatic stories, because those people sharing the most are the people who had the most traumatic experiences.
Yes.
Okay?
Yes.
So the first thing I did when I did my doula training, I went to see Ina Megaskin. I don't know if you know her.
Yes.
She's a very experienced midwife and so wise. And this was the first day of my training. And I ended up to this conference. And the name of the conference, it was Less is More. And she was like, okay, nowadays there is too much. You need to be able to focus on the positive, on the right information. And she wrote a book about women's birth stories, positive birth stories. And even sometimes they are difficult, they ended up, but to show that this is possible. Those birth stories, good birth stories are possible. So it's better to read a book like this with positive experiences than to have your friends telling you, and especially French friends. So I think for me, the most important is to stay on the positive side. It's all about positive energy. You know, if you put yourself into, oh, I'm going to have problems in my pregnancy, my baby is going to be in trouble, my birth is going to be difficult, and it's negative, and you put yourself in a negative mode. It's you.
That's the laws of attraction.
Exactly. You attract what you have in yourself. If you have positive energy, you're going to have a good team. You're going to have a good experience. I really think that this is very, very important nowadays, where you have so much information, but most of it is negative. So I'm really like, okay, find the right person who is going to give you the information and follow this person and stop looking everywhere else. That's what I would tell to parents nowadays.
And I think that's a great advice. Yes.
Just because I'm too proud of it, I'm going to be a grandmother next year.
Oh, congratulations. That's fantastic.
First baby girl coming in March.
Oh, sweet.
I'm so happy. And this is what I told my son and my daughter-in-law is that be positive, follow your instincts, be close to each other, this is the other part of love. This is love. Okay. And stay in the positive side, because if we have to go in the negative, we will go in it. But most of the time, 90% of the time, remind this to everybody that 90% of the time, everything's fine. Okay. So I'm always the one looking at the glass half full. And this is a state of mind. And when you're pregnant, look at the half full glass.
Yes.
Don't think about the problems.
Yes.
Okay. In the first place.
I fully agree with you, Pascale. I think that's a great advice that you are giving. And I'm really thankful that we got to record this episode together. I thank you for this very inspiring and enlightening conversation that I cannot wait to share also with my younger cousins, so that when they are pregnant, they are also a bit inspired and hear, another story about childbirth than the one that I've heard when I was pregnant.
Exactly.
I think that's the whole idea of this podcast, is really to share about the truth and the positive side of childbirth rather than the horror stories. But thank you so much, Pascale, for sharing everything with us.
It was a pleasure.
Thank you so much for listening. I hope this conversation brought you inspiration, comfort, or maybe simply a moment to pause and reflect. If it resonated with you, don't hesitate to share it. Take care, and I'll see you very soon.